Finally tonight, when it comes to COVID-19, things here in Western New York and around the area are looking up. Travel is picking back up, businesses are back open, and people are starting to shed their masks again. But new numbers show the pandemic is far from over. The number of COVID-related deaths has reached 6 million worldwide since the start of it all. That is according to the latest data from Johns Hopkins University. The United States has the biggest official death toll in the world, nearing 1 million reported deaths on its own. Back here at home in Western New York, it's now considered to be a low-risk level for community transmission of COVID-19 based on new cases per week and hospital admission levels. County cases have fallen below 100 per 100,000 residents over a 7-day period, and hospital admissions due to COVID-19 have also plummeted. And Erie County has ended its nearly 2-year state of emergency. We asked Dr. Thomas Russo, Chief of Infectious Disease at UB's School of Medicine, if we're close to that endemic we've been talking about, and if so, when would it be official?
I don't think there'll be a formal declaration that we're officially in endemic mode, but I am anticipating and quite hopeful that cases will continue to fall, that we're going to get to very low levels that we saw earlier last summer, just before 4th of July. I'm hoping for a great spring and a great summer. However, we're not done with COVID. It's still hanging around. And as we get back into those cooler late fall and winter months, individuals that are still susceptible risk for getting infected and will likely have a bump of cases as we see with every influenza season in the winter months.
Well, the pandemic has led to several unintended consequences. According to the American Dental Association, about 70% of dentists say patients are showing up with cracked teeth, severe TMJ, and complicated cavities, all related to the lockdown. Sonia Azad from our sister station in Dallas has some tips for those who need to catch up on their dental work.
All right, let's take a look.
Let's be honest, a lot of you have skipped out on a dentist visit or two since the start of the pandemic.
Patients were scared to come into the dental office. Dental offices were shut down for 6 weeks or so. Write down.
Dr. Gaznia Khan says neglecting oral hygiene has led to major problems on the back end.
We see patients coming in with broken teeth, broken crowns, broken fillings. So open up.
The main cause, clenching and grinding.
It's mostly stress-induced. So when my patients come in and I say, hey, what's changed in your life? It's usually marital statuses have changed, employment statuses have changed, just life overall during the pandemic has changed.
So what can you do about it? Dr. Khan says make an appointment and get diagnosed.
Early treatment is going to be the least expensive.
Muscle relaxants, Botox around the jaw, and night guards can protect your enamel and prevent you from chipping away at your teeth.
I always tell my patients, enamel is the most sacred thing in your mouth. It's the hardest substance in the body, and so if you wear it down, there's no getting it back.
Another common COVID-era dental disaster is pain.
If dental pain and if tooth pain is keeping you up at night, it's usually an emergency.
Ignoring small cavities can grow into big drama. Headaches, migraines, and sensitivity to hot and cold.
We know that smaller cavities present as mild sensitivity, but once they get deeper, they turn into pain, throbbing pain, extreme sensitivity to hot or cold. So if you let those cavities get deeper, they're more likely to cause you pain.
Dr. Khan says brushing and flossing twice a day will make a big difference.
Remember, you should be spending about 10 minutes on your mouth every day.
All right, you hear that? 10 minutes on your mouth. And you know what? While you're at it, if no one's told you this yet today, unclench your jaw, put down your shoulders, take a deep, deep breath. That can probably help all of us, no matter what. We want to thank you so much for joining us for the town hall tonight. Here's a reminder of our text line, 716-849-2220. It's the best way to get in touch. Let us know what you'd like to see here on the show.